AAMG. Your choice, your health, our mission.
Good morning, everyone. Welcome to AAMG YouTube channel. Today we have very honor to invite our AAMG physician. His name is Victor Kwok, and he is a geriatrician, meaning specialized in caring for people over 65, and he also an internal medicine physician. Welcome, Dr. Kwok.
Thank you very much.
So Dr. Kwok has an office at Noriega Sunset District of San Francisco, and he's very kind, and he currently also accepts new patients. Welcome, Dr. Kwok, again.
Okay, thank you for having me. I'm happy to be talking about the seasonal flu today. So influenza is a type of respiratory illness, and the seasonal flu is caused by influenza A and B. This disease happens mostly in the winter season, and in the 2018-2019 season, the CDC reported that there were 35 million cases of the flu, and 34,000 of those resulted in death. In 2017 to 2018, the CDC reported 45 million cases and close to 61,000 cases of death as a result of the flu, and this was the highest since the 2009 H1N1 pandemic. How is the flu transmitted? Mostly transmission is through coughing and sneezing. A large amount of virus is in the respiratory secretions, and it's possible to breathe the respiratory droplets, and that the transmission is done that way. It's also possible that, if you come in contact with contaminated surfaces, that you can also contract the flu virus in that regard. The incubation period of the flu, it takes about 24 to 48 hours for the flu to develop, and during this time, the infected adults are usually asymptomatic. However, they can already start spreading the virus during this time. In uncomplicated cases of flu, it lasts about 5 days on average. Some people will feel weak and tired for up to several weeks, however. And in children, the elderly, chronically ill, or immunocompromised, the virus can be detected for up to 3 weeks. How does this compare to COVID-19? So COVID-19 also causes a respiratory illness in some people, while others may be asymptomatic. So the difference here is that the flu usually is symptomatic after a couple of days, but there are people with COVID-19 that can be asymptomatic during the entire course of illness. Transmission is similar to the flu through contact with infected people by respiratory droplets such as sneezing, coughing, or even talking, and possibly from contact with contaminated surfaces as well. And compared to the flu, the COVID-19 may take up to 2 weeks before symptoms show up. And during this 2 weeks, they can be spreading the COVID-19 without knowing. Recovery time for people that contract COVID-19 may be 1 to 2 weeks, but in more severe cases, it could take more than 6 weeks to recover. In symptoms of the flu, people usually develop an abrupt onset of symptoms, such as fever from 100 to 104 degrees, or even higher. They also develop headaches, myalgia, which is muscle aches, malaise, cough, runny nose, sore throat, and those are some of the common symptoms of the flu. However, in the elderly, symptoms may be different. So in the elderly, fevers, myalgia, sore throat, these symptoms may be absent. Instead, the elderly have more complaints of anorexia, that's a loss of appetite, malaise, weakness, and even dizziness. So the symptoms of COVID-19, a lot of these symptoms overlap with symptoms of the flu. So both the flu and COVID-19, you can have fevers. So some people having COVID-19 may be asymptomatic, as I mentioned. Sneezing is less common in COVID-19, and loss of taste or smell, this never happens in the flu. Congestion, sore throat, both of these things can occur. Diarrhea has also been reported. Body aches, although some believe it might be less severe than in the flu. Headaches, fevers and chills are quite common. Cough, fatigue, those are also quite common in COVID-19. So the complications of the flu, this is why we care about the flu, because some people can develop complications, and the most important one is pneumonia. So this will more commonly occur in children under 5, the elderly, which is 65 and older, in nursing home residents, pregnant female, people with lung disease such as asthma or COPD, people with heart disease such as CHF, people with diabetes, immunocompromised such as cancer, people on immunosuppressive drugs, people with HIV, and in people that have had stroke. Compared to the common cold, influenza is different. So the onset of influenza is more sudden, whereas in the cold, people develop more gradual symptoms. So they may start with a runny nose and then a scratchy throat, whereas in the flu, they just suddenly are hit with more severe symptoms. Fever, too, is more common in influenza than in the cold, especially high fever. That almost doesn't occur in the flu, in the cold. Developing a cough, the cough might be different as well. So in influenza, it might be more of a dry cough that's severe, whereas in the cold, people have more of a hacking cough. Maybe they complain of a scratchy throat and they have a lot of coughing from that. Headaches are more prominent in people with the flu. Same with muscle aches. Tiredness is more of a major complaint in the flu versus people with a common cold, which they are tired, it's usually just brief. Extreme exhaustion is also a common complaint in the flu, which is not common in the common cold. Chest discomfort, also more common complaint in the flu. And then stuffy nose, sneezing, sore throat, these things are a bit more common with the common cold. The flu compared to COVID-19, a lot of the symptoms are overlapping. So they both develop fever, fatigue, cough, sore throats, headaches, runny nose, shortness of breath. These are all sort of overlapping symptoms. Body aches and diarrhea also reported. However, COVID-19 is unique in that it has complaints of loss of smell, loss of taste. There's also reports of eye symptoms such as conjunctivitis, and also reports of having a rash. How do we prevent the flu? There are different ways to prevent the flu. Vaccination is one of the most common ways and most effective ways. There's also medications, respiratory hygiene, and hand hygiene. So what is vaccination? Vaccines are, basically we use vaccines. So vaccines present dead or weakened virus or bacteria into the body, and then your body will respond by producing antibodies. So the immune system is triggered to do that once the vaccine presents this material into your body. And you develop the antibodies, and when you encounter the real virus or bacteria later on, you already have the antibodies to fight off the disease or prevent the illness. The flu virus and the flu vaccine. So the CDC and World Health Organization monitor the flu activity around the world. And the flu vaccine is produced by selecting the strains that are active during the particular flu season. However, they are selected for production about 6 months before the flu season because it takes time to develop the vaccine or produce the vaccine. So during this time, sometimes there's mutations in the flu that can occur. The types of vaccines, there are flu vaccine come in trivalent or quadrivalent vaccines. This means that it has 3 strains or 4 strains of flu virus. In the trivalent, there's 2 influenza A strains and 1 influenza B. In quadrivalent, there's 2 influenza A and 2 influenza B. The vaccines can also be classified as inactive or live attenuated, which means it's either dead virus or severely weakened form of the virus. It can be given to you through an injection or through a nasal spray. And also because the vaccines can be classified as having a standard dose or a high dose. And there's also an additional one called an adjuvanted dose, which it contains an extra ingredient to help stimulate a more robust immune response. With the exception of one trivalent vaccine for this year, all the flu shots this year in 2020, 2021 are all quadrivalent, which means they will contain the 4 influenza virus strains. There's also a low dose that's available for, for children 3 months to 36 months old. The high dose, or the Fluad, which is the one with the extra ingredient, is meant for 65 and older. There are flu shots that are produced using mammalian cell culture, and there's a flu shot that's produced using recombinant DNA technology. And the live attenuated one is a flu mist. This is the one that's a nasal spray. The rest of the vaccines are egg-based in production. So there are people that are concerned about egg allergies. So the vaccine dose is usually 0.5 mLs, and within that dose there's less than 1 microgram of egg protein. So people that have egg allergy who have had the flu vaccine have not reported any serious illness. So most people getting the flu vaccine that's egg-based have no reaction to it. If you're concerned and you have an egg allergy, you can choose vaccines that are not produced using chicken embryo. Here are the listed types of vaccines that are available for the 2020-2021 season. As you can see, the majority of them are egg-based. There are the 2 that are either cell-based or recombinant DNA-based. You also notice that there are shots here for 65 and older. That's the high dose and the adjuvanted vaccines. Who should get the flu vaccine? Now, the CDC recommends that everyone aged 6 and older receive the flu vaccine. The priority should be given to high-risk individuals, such as young kids, people older than 65, pregnant female, people with lung disease, heart disease, or diabetes, or immunosuppressed. Healthcare workers and people that are caregivers taking care of these high-risk individuals should also receive the flu vaccine. The CDC, however, does recommend that everybody get it, and that they should get it by the end of October, especially this year, given that we're in a pandemic. The flu vaccine helps to prevent flu, helps to reduce visits to the doctor, to the hospital, helps to reduce sick days from work and severity of the flu if you unfortunately still develop the flu after getting the flu vaccine. The flu vaccine can prevent people from dying, so children and elderly are the main targeted groups. And you can get the flu vaccine anytime during the flu season as well. So it doesn't mean that you have to get it by the end of October. Do I need the flu vaccine? Well, millions of people get the flu each year and hundreds of thousands get hospitalized. For example, a couple years ago, there was a record-breaking amount of hospitalizations, up to 900,000 were reported. Thousands die from the flu each year. So in a mild year, around 12,000 people still die from the flu. In a more severe year, 56,000 people die from the flu or flu-related diseases. 80% of those who died did not get the flu vaccine. And 90% of those who die are older than 65. So these are the groups we're trying to target. The flu vaccine changes each year, so you need to get one every year. So if you got one last year, doesn't mean that you don't need one this year. again, the best way to prevent the flu is to get the flu vaccine. There are people that worry about getting the flu from the flu shot. That doesn't happen because the flu shot doesn't contain live virus, except one that's severely weakened, and those have not been shown to cause disease. The rest of the majority of the flu shots have killed virus and are unable to cause illness. The most common side effect from getting a flu shot is just redness and swelling at the injection site. Some people will develop a low-grade fever, muscle aches, headaches even, but most of the time this will go away in a day or two, and if the symptoms are uncomfortable, taking a Tylenol might help you alleviate these symptoms. Respiratory hygiene. This is another way to prevent catching the flu. So this is basically covering your mouth and nose when you're sneezing and coughing, practicing good hand washing, or if that's not available, then use an antibacterial sanitizer, hand sanitizer. And of course, avoid touching your nose, your eyes, your mouth. This is ways that you can introduce the virus into your system. Wearing masks. So we're in a pandemic, so everybody's wearing a mask these days, but masks have been shown to be helpful when you pair it with hand washing. The CDC recommend that healthcare workers wear masks when handling infected patients. The infected people who wear surgical masks have been shown to prevent spread of illness. And N95 masks are not necessary for this purpose, and studies have shown that as long as you wear a mask, you'll be able to help prevent disease. So in the current pandemic, some areas are promoting universal mask wearing as a preventive measure, and studies do show that wearing a mask helps to prevent the spread of the flu and COVID by reducing transmission from an infected person. It's also been shown that wearing the mask helps to reduce overall rates of flu and of COVID in the community. So any mask will help reduce the transmission of these respiratory illnesses. Cloth masks are the most common and most available. While surgical masks might have a slight edge in effectiveness, they are currently preferred to be reserved for healthcare workers. N95 is not really recommended for this because most of the time they're uncomfortable. It leads to people touching their faces, adjusting their masks frequently. So it's important to remember that you should choose a mask that's comfortable to wear and something that you can wear for a long period without having to touch your face or adjust the mask. Another way to prevent the flu is using anti-flu medications. So the two that are here, one is Tamiflu. This is taken 1 pill a day for prevention. And there's another medication called Relenza. This is an inhaler, and you would inhale 2 puffs a day, also for prevention. This is not good for people that have sensitive airways, such as people with asthma, because it may trigger your asthma. But who should be using this for prevention? So we normally reserve this for outbreaks. So in a nursing home setting, if a resident develops the flu, then the rest of the residents will be getting the medication for prevention, even if they have been vaccinated. And high-risk individuals who come into contact with people with the flu, they may choose to also take the medication for prevention. These are people with low CD4 counts, bone marrow transplants, lung transplant, or anyone that's immunosuppressed. Kids younger than 5 years old, people older than 65, or pregnant women may also want to be taking medication for prevention if they're exposed to known flu people. It's best to start the medication after 48 hours, within 48 hours of exposure, and also to get a flu shot if you haven't. Of course, the antiviral medications can also be used to treat the flu, and the people that take the medication will shorten the course of the flu and also cause the flu symptoms to be milder. It again works best if you start it within 48 hours, but can be started after that if needed. helps to prevent serious complications from the flu and also helps to prevent hospitalizations. The types of medications available are, again, Tamiflu, but this time you take it twice a day. And again, there's Influenza, and this is 2 puffs, now also taken twice a day instead of once a day. Again, this is not good for people with airway sensitivity. Additionally, there's also an IV medication called Rapivab, which is given 600 milligrams IV times 1. So this would be for someone that's hospitalized. And there is another oral medication called Influenza. This is taken once, 40 milligrams for treatment. However, the experience is more with Tamiflu, so that is still the go-to drug when someone does catch the flu. So thank you very much for listening to the presentation today. I hope you stay healthy and stay safe. Thank you.
Thank you so much, Dr. Kwok, for giving us such a wonderful precaution and advice, and hope everyone stays safe. And thank you for watching our video channel. Thank you.
Thank you for watching this AAMG YouTube channel. If you have any questions or comments, feel free to leave the comment down below this video. We try to get to your questions or comments. Always remember, subscribe, like, and share this video to your friends and family so more people can be benefited. Thank you for your support.